Hello, everybody, and welcome to this episode of In Lay Terms. I'm your host, Payman Ascari, and my guest today is Dr. Anna Sylwestrowicz. How are you doing, Doctor?
Good morning, and thanks for the opportunity, Payman.
No, thank you for coming on, and thank you for sacrificing your Sunday morning to be here.
Well, it's something that is very important to me, and I've been at it now for 3 years, and I don't feel like my voice is being heard. So any opportunity that I have, I take in order to educate the public about what is really going on in our healthcare system.
Very well. I think we agreed that we would start with your credentials, and there's a reason for that, if you could give that as well.
So I graduated from medical school in 1991 from University of Manitoba. And I went on to finish an anesthesiology residency in 1996 at University of British Columbia. And I advanced my academic career until I became a clinical assistant professor in anesthesiology, pharmacology, and therapeutics at UBC. And then at Island Health, it's called anesthesiology, pain, and perioperative medicine. I resigned from that position in 2020 at the beginning of the pandemic. And I opened my own business called Dr. Anna Medical Aesthetics.
So for us, ordinary folk, probably a lot of that just went over our heads. But you said it's really important because they're pretty much everybody in power. They're appointed. They have no, they're not experienced in this, and then you are, so they're actually going after you to discredit you.
That's correct. So when I started speaking up about this topic, because it affected our family quite personally, in 2021, the letters started to fly in, and basically I was within 24 hours fired from my health authority and escorted by security out of the hospital, having to give up my access card, my parking pass. And despite having worked for Island Health for over 2 decades, and I've never had any issues with the college. It's been incredibly eye-opening what happens when you actually speak truth to power.
So what exactly happened? You said when the letters start flying in, was this members of the public that were personally attacking you?
So one of our family had an issue during the pandemic, and as you know, we had very aggressive lockdowns. I don't know if it was across Canada but certainly Island Health, which is Vancouver Island. We had what were called COVID pandemic lockdowns from 2020 to 2024, where the hospital was essentially in kind of lockdown mode. There were limited beds, limited access. A lot of family doctors' offices were closed. And as most people in BC, about 1 in 4 people don't have access to a family doctor. And there were no walk-in clinics. And, when people had trouble, whether they had lost their job or something traumatic had happened to them, many people turned to the hospital to get a little bit of mental health support, whether that be for a panic attack or depression or whatever. And everybody is told to trust the system. Well, it turns out that I completely didn't understand how the system works. And I nearly lost a family member. And then I realized when I started speaking up about it, how I believe that psychiatric emergency services, or PES, at the Jubilee Hospital, which is our mental health program here, really needs an independent external investigation for human rights abuses. They started telling me, and I started speaking up on social media. I got a letter from Island Health saying that I was a danger to the public for spreading dangerous misinformation to a vulnerable patient population, which may lead them to stopping their medications, leading to suicide or homicide. And because I had already resigned in 2020, they couldn't do anything about me. So of course they went after me at the college level. And I got a phone call from the college. I had a meeting with the college with a number of people. And the conclusion was that, indeed, I probably shouldn't be disparaging my colleagues, but that I was speaking from an ethical perspective. And they did agree that probably there was some ethical misconduct. After that, the health authority pursued me through University of British Columbia, and I got a letter from the Dean of Medicine at UBC saying I should stop using my credentials and any affiliation that I have with University of British Columbia, because I no longer practice anesthesiology at Island Health. The letters continued from a nonprofit organization which receives funding from the Ministry of Health and from pharmaceutical companies. That's the BC Schizophrenia Society. And they had screenshotted all of my social media posts on X and got a very aggressive lawyer in Vancouver saying that they were going to sue me for defamation because I was pointing out that there is a huge pharma influence and a lot of nonprofits and patient support groups and patient lobby groups. And, in every area of medicine, doctors were taught the Hippocratic Oath to first do no harm. And I always tell other doctors that I'm training, I always say, when you see a patient, if it's something that you wouldn't do to yourself or your family member, you really shouldn't do it to somebody else. So if it's a treatment that you would not want for yourself, why would you do it to a vulnerable person that you're looking after? And anyway, that's the backstory of everything. And so having gone from a career of 33 years in medicine, not a single college complaint in my 30 years, to now just back and forth with the college and back and forth with all these letters, and it's really discouraging. It's discouraging how my health authority is treating patients, and all because they can use the law to weaponize it against them and enroll them into entirely for-profit, pharma-funded clinical trials, they call it, or clinical research, or pharma initiatives without any informed consent.
Okay. Lots of questions. First of all, Kirk, I see your comment in the comment section. I'm going to get back to it because it's something that the two of us are going to be talking about later. You mentioned to the average person, like you walk by a clinic, you have a family doctor, you know what that is. You break your arm, you go to a hospital, you know what a hospital is. What is a health authority? Like in just simple terms.
So in British Columbia, we have a number of health authorities. And I can't remember exact numbers, but I think it's something like 8 health authorities. Like there's Coastal Health and Northern Health and Island Health and Fraser Health. And these health authorities are administration that runs the hospital. So out of the $30 billion that is spent on healthcare in British Columbia, a big proportion of that doesn't go towards doctors and nurses and the support staff, or as my retired obstetrician gynecologist father calls them, it seems to go to people that are non-clinical, non-direct patient contact, that have nothing to do with patients, many working from home remotely, telling all the worker ants how to practice medicine, what to do, what not to do, the bureaucrats. And if you look at the board of directors of, whether that be the 2 health authorities that really stand out from many other authorities because they are not practicing in the same standard of care as across the rest of Canada, are Island Health and Fraser Health. And so if you look at their board of directors, many of those people have been hired by our provincial government, and they're bureaucrats put into these positions of great authority over everybody else. And they may not have, they may be social workers or lawyers or people that worked for unions, but they don't necessarily have the credentials or the understanding of how a hospital works. And to give you an example, there are people that, the intensive care doctors were actually arguing with the administrators because they had no idea there was a difference between a surgical intensive care unit and a medical intensive care unit. So it's like putting me, I know everything about healthcare inside out and practicing medicine and have a very broad scope of practice, but it's like putting me into a portfolio about climate change or housing. I wouldn't have a clue where to start. And that is what happens in in politics. People that are put in charge of a lot of money in these big portfolios, and they they often don't really understand exactly what their policies are doing or how it plays out, because they don't understand how the system works from the inside out.
So my question, to make it even more basic, is it a these health institutes, are they private corporations? Are they crown corporations? Do they bid on a tender?
So health authorities are, every time you criticize a health authority, they say, well, that's a Ministry of Health problem, but they work together. So the people that are appointed to the health authorities, it's public health care. It's government organized.
So
So you're,
it's a private corporation, but it's so heavily influenced by government that it's almost a crown corporation.
well, it's entirely influenced by government because we don't have private healthcare in Canada. Or in BC, everything is covered by government. You know,
Are-
universal healthcare, universal access, it's supposed to be, it's all funded by the taxpayer. So we pour $30 billion into healthcare annually in BC, and people are not seeing, they're not getting the care. There's no access to care. It's not universal. It's difficult to access. And during these lockdowns, there were no walk-in clinics. A lot of family doctors were closed. All that was available was telehealth, which I can get into as well, because there's a lot of conflicts of interest with that corporation and some of the people that are in charge collecting data. Um, and the health authorities then were dictating on pandemic lockdowns, the COVID rollout, all the rest.
So I swear this is the last sort of basic question before we actually get to your claim. Uh,
Mhm.
for the benefit of the audience, what is the College of Physicians, and what is its role as a licensing authority, or if it regulates the universities and handing out the medical licenses?
Right. So I believe the college is an important organization, but it's supposed to serve the public. The college is there to for patients to file complaints against individual practitioners in order to ensure their safety and accountability, and um, that they're not doing any harm. So if there are repeated offenders, repeated complaints, you would hope the college would address um, the practicing doctors. And they also regulate how many people enter the system annually. So to give you an example, in 1991, I was a rotating intern here. At the time, it was called the Greater Victoria Hospital Society. And out of the 20 people in my rotating internship year, I believe 17 stayed here or left for the forces, but all became family doctors. There was a surplus of family doctors in 1992, and it was very difficult to get college licensure from the college and a billing number from Medical Services Plan. Without the two of them, you couldn't really practice. So without having a college number and without having an MSP number, you can't really practice medicine and bill government for your services. And so what was happening were a lot of doctors were selling their practices to new graduates, and they were being mentored into the practice and then paying $60,000 to $100,000 for a medical practice. And then because of lack of planning and not looking into the future, not looking at that we would have more women in med school, more people would be interested in working less, and the population was getting older, and that in BC we have a lot of people from different provinces that come to retire here. And now we find ourselves in a crisis situation where we don't have enough family doctors. But actually looking at the numbers, I believe there's something like 7,000 family doctors in British Columbia. So we do have the numbers, we just don't have them practicing. So why is
Is
that?
is that because the college is not giving them those two numbers you've said?
I believe the college makes it difficult sometimes. again, it's an important organization, but sometimes the college overreach is significant. And some of my older colleagues that have quit medicine, it's because of the college. It's because it's become a little bit too cumbersome. And now I have some issues with the college. I find it's an important organization in order to protect the public, but yet I find that they discipline doctors that perhaps shouldn't be disciplined and let other doctors get away with things that they shouldn't be getting away with, because it used to be a bit of an old boys club as to who knows who. And if you knew the right people, you could always, you'd continue practicing. They would just bury everything. The other problem is you can't report other physician colleagues to the college. They won't accept that. You can't say, I'm really concerned about this clinician or that doctor. They don't listen to that. So you can't self-report. You can't disparage your colleagues, so to speak, right? And so they won't accept that. And also they never used to accept they used to accept anonymous complaints. So when I left the hospital, all of a sudden there were several anonymous complaints that I had to that were really trivial, but people were sending in anonymous complaints and you had to respond to everything, which seems also nonsensical.
I guess shifting gears, can you tell us about the Mental Health Act? You were explaining this to me, but if you could just tell us what it is and what the impact of it has been.
So until it affected my family personally in 2021, I was not at all familiar with the Mental Health Act of British Columbia. And it looks to me like we have three pieces of legislation in BC. One is called the Infants Act, one is the Mental Health Act of BC, and one is the Adult Guardianship Act that can be quite problematic and misused and what I call weaponized against the family or the patient in order to get what they want. And in medicine, sadly, and I'm quite advanced in my career and I'm at the end of it, but sadly, sometimes certain specialists in positions of great authority truly think they're gods. And we don't really have the advantage in a universal healthcare system of getting a second opinion or questioning their authority. You're assigned a doctor, you're assigned a specialist, and you're told to trust the system. But nothing in medicine, if you look at the history of medicine, if you interview old doctors, nothing in medicine is as black and white as many experts in positions of great authority say it is. And to use the law to weaponize it against families is very, very problematic. So with the Infants Act, for example, a child can be prescribed a large dose of an antidepressant, such as an SSRI like Prozac, and go on to commit suicide. And the parents don't even know that there was a prescription written. Under the Mental Health Act of BC, we apprehend 30,000 people in British Columbia annually. They are force treated. 20,000 of those people are force treated with mental health medications. How do you force treat someone? Well, you inject them. You inject them with a long-acting depot antipsychotic. So David Eby had actually in 2022 said, this is quite problematic. We need to move away from this Mental Health Act. We need to give patients more rights. But then, of course, during the election, he backtracked and said, no, we need to have more involuntary. And the Conservative Party was saying we need to have more involuntary. And my feeling is neither political party truly understands the word involuntary and how that is used. So first of all, we ignore the people on Pandora and Hastings that are drug addicted, crack addicted, homeless, and those people are not under the Mental Health Act. The people that are under the Mental Health Act are single moms, anybody that's involved with the Ministry of Children and Family Development, eating disorders, people that are struggling, students that have been smoking cannabis, somebody that gets in a little bit of trouble with the law, and people that are dependent on government for shelter, for housing, like the PHSA, Provincial Health Services Authority. So these people are injected, forced, coerced, threatened with long-acting depot antipsychotic injections. And the BC Schizophrenia Society, the nonprofit, actually has stated that 1 in 30 British Columbians will have an episode of psychosis, and they are very much for the Mental Health Act and forced involuntary treatment. So this is a very slippery slope that the patient has no rights and no voice. And once they're injected with this drug, they're essentially under the Mental Health Act. And during COVID, I followed several women. They were recertified over the telephone, sight unseen, every 6 months and injected with more depot antipsychotics with no plan to wean or discontinue these drugs. These drugs are incredibly dangerous, and the longer people stay on them, the more difficult it is to come off. So when Sackler, who was a psychiatrist, promoted Purdue Pharma and OxyContin, the drug reps went around everywhere with free samples, and the idea was to give a 30-day free sample in order that the patient became physiologically dependent on the drug. And so this non-addictive drug all of a sudden created a lot of problems because that's how Purdue marketed it as. So now there are drug companies, Janssen and Otsuka, that are marketing these convenient injections of depot antipsychotic medications. And according to the pharma paid experts, they're supposed to ease caregiver burden, facilitate hospital discharge, and be cost effective. So they're being promoted, and you can well imagine that this medication is now sitting in a muscle as a depot, and it's there with a T to the half-life of 50 days. So elimination is approximately 5 months. And there are certain populations, such as First Nations and Asians, that do not metabolize these neurotoxins at all. And there are lethal drug interactions, side effects, and of course, the blood work isn't done to monitor any of this. They're not getting their thyroid monitored or EKG monitored or any other blood work. It's just an injection and an escort by security to the bus stop and booted out the door.
There's someone in the audience. So this is what I was talking about. Kirk Reese, he's a whistleblower for the Canadian Armed Forces, and they hit him with the Mental Health Act. They said he was mentally, I don't know, unstable. I don't know what the term is, but he's saying, good for Dr. Anna for standing up. So you have some supporters amongst the audience.
Oh, I do. And specifically the drug that, so the two drugs being used an awful lot in British Columbia are Invega and Abilify Maintaina. And neuroleptics, neurotoxic drugs, otherwise known as antipsychotics, are what are called dopamine blockers. And dopamine blockers used long-term have irreversible side effects. And one of the more troubling ones is called tardive dyskinesia. They also have incredible metabolic side effects. They cause hypertension, hyperlipidemia, cardiovascular problems, and incredible weight gain with 4 times the incidence of type 2 diabetes. The problem with Abilify Maintaina, which is the one that they're using in the armed forces, because 1,000 VA hospitals in America are on the Abilify Maintaina hospital free trials program. The VA data, from what I can find, doesn't look very promising. And these drugs used long-term lead to suicide, homicide, overdose, compulsive drug use, and they're incredibly problematic. This drug is incredibly problematic. And so when I called the FDA to ask how many more adverse events do they need before recalling this drug, because there's 56,000 adverse events. There's been thousands of lawsuits when the drug was under Bristol-Myers Squibb. They've had a number of deaths, close to 10,000 deaths on the depot injection. Of course, everything is top secret because they talk about patient confidentiality, this and that. But I can tell you for a fact, to give a drug that has significant dopamine agonist properties like this drug has, it is leading to suicide. This is not a drug that is there to save lives. This is not a drug that's listed on none of these drugs are listed on the World Health Organization list of essential life-saving medication. These are not life-saving drugs. These are entirely for-profit, pharma-funded clinical research, they call it, but it's just a marketing initiative for drugs, and it's not a standard of care in any other province, nor is it a standard of care internationally.
I have a question. These health authorities, the government, they come and they tell people, whistleblowers, anybody that criticizes them, they tell them, you have PTSD or you're bipolar, and then they put them under so much pressure that they develop symptoms of PTSD or bipolar disorder. Is this the same thing with these drugs, where they accuse them of something and then they put them on drugs, and then they're like, "See, we told you this guy was, mentally unstable."
So there's I'm actually reading a book by a gentleman named Robert Whitaker. Robert Whitaker is a journalist who has written a fantastic summary of psychiatry in North America. And one of the things that I thought was very interesting is that there's a chapter 9, and it's called the bipolar boom, okay? Because we've had the incidence of, to just say psychosis is schizophrenia or psychosis is bipolar, or just to use these terms interchangeably, is incredibly naive, and it's actually really scary, because we've given the prescribing authority to nurse practitioners and nurses and naturopaths and pharmacists. As of November 2022, the scope of practice of a lot of people has expanded. And so drug companies can go around and talk to the nurses about, dopamine balancing, or talk to the family doctors about this. But nobody really goes and looks at the phase 2, phase 3, phase 4 trials. I can guarantee you, none of my family doctor friends have dug into the literature like I have, into clinicaltrials.gov, and looked at the studies. And you're looking at the studies and you're going, oh my goodness, all the rats are dying. The animal studies have produced alarming results. All the rats that were fed this for 4 days ended up with neurons that were swollen and twisted like corkscrews. Or the bipolar boom, which is what's happening now. Everybody is bipolar 1, 2, bipolar 3. Psychiatry is trying to make itself into a legitimate medical specialty, and having diagnoses and treatments for every human emotion, when in fact 70 years have shown that there is no treatment for human emotion. And psychiatry has been a big failure, an enormous failure, with more and more prescribing, more and more polypharmacy, prescribing cascades, and yet disability rates are going up threefold in North America. Suicide in USA is still at 50,000 annually. Nothing has changed. Suicide prevention, none of that has changed. So the bipolar boom, I would like to point out that in the history of medicine, there are many examples of situations where the vast majority of physicians did something that turned out to be entirely wrong. The best example is bloodletting, which was the most common medical practice from the 1st century AD until the 19th century. And I'd like to point out that Monitz, who invented the frontal lobotomy with the ice pick lobotomy, got the Nobel Prize. And Semmelweis, Dr. Semmelweis, who recommended hand washing as a form of antisepsis, was put into a mental asylum. So yes, it's important to start asking questions, being a critical thinker, and asking questions should not be shut down, because there's nothing in medicine that is as black and white as they say it is. And there's certain parts of medicine that are incredibly pharma marketing driven. That is medical oncology, urology, cardiology, and psychiatry. And other parts are not as pharma driven. Anesthesia, emergency medicine, and critical care medicine, for example, orthopedics. So general surgery. So I think it's important to really start talking about this. And because I think I mentioned to you yesterday when we were chatting, the Island Health lawyer that was hired by Island Health, by this health authority, came from Alberta. And she had written a long list of problems with Island Health. She said it was one of the worst health authorities she's ever worked in. In fact, we rank very low according to Canadian Institute of Health Informatics in BC with our healthcare. And they fired her. And so she, as a lawyer, decided to pursue them for wrongful dismissal. And I have the court documents from June. In June 2019, the Island Health CEO in court said that the lawyer, the plaintiff is mentally ill. The plaintiff has threatened to kill herself, which is not true. The plaintiff posed a threat to herself or others, and the plaintiff requires immediate psychiatric hospitalization. And what happened? The police showed up at her door. That's called a Form 21. And that's what happens. Psychiatry can issue an order to the Victoria Police, Saanich Police, Oak Bay Police to bring patients into the hospital. There are actually 70 different locations for their mandatory long-acting depot antipsychotic injections. And one of the women that I've been advocating for, her name is Kirsten, and her story was written up in the Capital Daily. It's called Against Her Will, and we had an investigative journalist investigate this. She's been off her depot injections now for 6 months, and she's doing very well. But I would describe her treatment under our health authority as torture.
Going back, the lawyer, that story blew me away, by the way. Like, your lawyer disagrees with you, you fire them, the lawyer tries to sue you, and you claim that they're mentally ill. Like, what's the bar that you have to meet? Like, if somebody says the Canucks are the best hockey team in the world, can you claim they're mentally ill?
Well, so that's where, Scientology, for example, they're the biggest critics of psychiatry. And I'll tell you a little bit about my background. I'm a Polish immigrant. My dad grew up in a military family. His father was a military doctor, and my dad is a retired obstetrician gynecologist. His brother is a retired intensive care doctor and gastroenterologist. I know the history of medicine over these couple of generations. And in Russia, if you opposed the political regime, you would be deemed a soft schizophrenic and locked up. And these injections have been used for 70 years. This is nothing new. And, depot antipsychotic injections, whether they're given every 1 month, every 2 months, 3 months, and Israel even has one that's every 6 months, are they're very powerful hypnotics. They wipe out your brain. They cause frontal lobe damage. And these, I would consider, they're more bioweapons than they are mental health treatments. And so mental illness is an incredibly subjective thing. And in fact, they've looked at this before. There have been all sorts of experiments done where people present to different practitioners and different diagnoses are given. You're seeing a snapshot of a person in crisis, or you're calling out the health authority, or you're calling the police to bring someone in who obviously will be very distraught if the police shows up at her door.
I had a question about this ability to use the Mental Health Act to deem people mentally unfit and prescribe them against their will. Is it specifically through legislation power given to these these health authorities, or can I go ahead and file a complaint against my neighbor and get the RCMP to throw them in a mental ward?
I think you can probably file a complaint against your neighbor. So the Mental Health Act, the people that we have given all the power under the law to detain and apprehend are the psychiatrists, right? I believe family doctors could probably do that with a co-signature as well. But what happened in November 2022 in BC, and all provinces are doing this in order to cut costs, in that we're expanding the scope of practice of nurse practitioners and nurses and pharmacists. And in BC, nurse practitioners can detain for 48 hours, they can diagnose, they can prescribe and inject. And so you can see if a pharma-funded nurse is working for a drug company like Otsuka, this is a massive conflict of interest as well, if they're in the community. And so the health authority will actually act like a mafia, and they will designate certain pharmacies on this island There are two in Victoria. There's one in Nanaimo, one in Port Alberni, where the caseworker comes and she picks up her entire Tupperware bin of depot antipsychotics and goes out into the community to save lives. And they don't really know what they're treating. They're treating psychosis. And so I was on an ethics talk with Dr. Anna Kindy, and one of the psychiatrists, that is a forensic psychiatrist from Vancouver, said something unbelievably arrogant. He said, you know, I have the power, I have incredible power under the law. I could actually call the police to your home and have you arrested and detained and arrested. So they do have that power under the law. And he says, oh, I say that to my wife all the time. And I just thought the arrogance is astonishing. And the fact that Kirsten is my example, because the fact that she's been pleading for them to stop. She's been questioning her diagnosis, and I knew the family doctor. Sadly, the family doctor is no longer with us, so we can't have him advocate for her. But if you don't have a family that advocates for you, if you have no other specialist that advocates for you, if you're a foster child or a senior and you're stuck with one of these arrogant psychiatrists or a nurse practitioner that seems to think she knows it all, and it's incredibly alarming.
I posed this to you yesterday. Do we have some sort of like unholy negative feedback loop where pharma profits from people taking these drugs and the government profits from the treatment for those drugs? Is it just, have we lost the script here?
So someone in BC is making a lot of money.
Any suggestions who?
So it's always the bad apples are always at the very top. So well, without being sued again, you know, I just see a comment. He says that to his wife. That would cause fear. Yes, indeed. I was looking at his credentials. The person graduated from Wales 10 years after me. And he says, well, what do you think we should do with 30% of the meth addicts that are out there? And I thought, you know what? That's a whole different issue altogether. Let's not confuse homelessness and drug addiction with people that are struggling with their mental health and lump them all together and treat them all the same way. And it's a lot easier to arrest a single mother in a bathrobe and bring her in for her forced depot antipsychotic than it is to deal with the crackhead on Pandora. So we ignore those people. And my friend Loretta, who works at London Drugs, says, you know, the addicts are breaking into the store. They're stealing 8 to 10 times a day. We have catch and release policies. Those people are not addressed at all. The people that are being tortured are the people that are under the Ministry of Children and Family Development. Kids with autism, pot smoking kids, single mothers, developmentally delayed, people with disabilities. That's who's being tortured.
Regarding police officers, law enforcement officers, I asked you yesterday, how do they rationalize this? How do they live with themselves when they're going around just arresting people and throwing them into detention centers?
Well, first of all, they didn't know that someone is getting paid. Someone benefits from this, and it's not the patient. So in cosmetic medicine, there's a program that Allergan, which is now AbbVie, had called Brilliant Distinctions. And the patient signs over their data to the drug company in order to get discounts, free product on their cosmetic injectables. The Canadian Consortium for Early Intervention in Psychosis is an entirely pharma-funded entity started in Hamilton, Ontario, by drug companies, AbbVie, Otsuka, Janssen, those type of the long-acting injectable antipsychotic companies. The person in charge of that is a psychiatrist that used to be here in Victoria. She's now in Ottawa and still trying to get more people using depot injections, which I think is an incredibly dangerous direction. In fact, I think by doing so, in this book, for example, it says it's a trap. It's the same way. It's a trap. It's just like being on Tramadol, Tramadol, OxyContin. Once you start using these drugs, the natural history of a lot of these psychotic disorders, mental health disorders, the natural history was that people got better and they got back into the workforce and they didn't stay institutionalized. But now, of course, disability is rising. People are having recurrent problems, recurrent psychotic episodes, recurrent depressive episodes. So what has changed? Pharma. We're just overusing the drugs. We're over-prescribing, we're over-injecting, and the taxpayers paying for it, but the patients really aren't benefiting at all. So, and long-term outcomes are a disaster. So most of these studies, if you look at all the drug trials and clinicaltrials.gov, a lot of them are actually ghostwritten. They're pharma funded. So if you look at the conflicts of interest at the bottom, it says, sponsored by Otsuka. They're not double-blinded. This is not research. This is simply pharma marketing, trying to look scientific in order to sell their drugs. And so with the Panorama program, which is the Abilify Maintaina program, there was a number called, you called 1-833-EXP-CONN, and you enrolled the patient. And for enrolling the patient, there was a $3,000 honorarium. After the end of 6 months of injections, there was a bonus. After the end of 12 months injections, there's another bonus. There's also free product for the year. So the health authority is benefiting by receiving free product, kickbacks, honorariums, and the drug representative that is selling all of this actually is hired by Otsuka and flies in from Calgary in order to educate over lunches and dinners the prescribers on the benefits of the new wonder drug for dopamine balancing of the brain.
Thanks. Andre, I see your question. I'm going to ask that at the end. Shifting gears, you said...
Sorry, I forgot to tell you, we were going to talk about the police. So I've spoken to police many times, and they said to me, well, imagine if I was getting $20 for every parking ticket that I issued. Don't you think I would be running around issuing parking tickets? So when I asked them, this is a Form 21. So Form 21 is a patient is not abiding by the psychiatric recommendations. Unlike the Form 4, which they never do, because that would be all of our homeless population. Form 4 is bringing in people into the hospital that need support. Well, that's all the homeless and drug addicted in BC, these are huge numbers. But a Form 21 is once they've given an injection at the hospital or at the foundry, they're injecting children at the foundry, which is, to me, complete malpractice. We have a duty to apprehend and transport as per wishes of the issuing physician. And they don't have access to the medical history. They just go there. And I said, don't you ever wonder, the person is in their bathrobe, you're arresting her in front of her daughter. No, we're just doing our job.
Yeah, as the joke goes, where have I heard that before?
So everybody's just doing their job. And of course, the government introduces, at the same time, they expand the scope of practice of nurse practitioners, nurses, pharmacists. Pharma gets in there, and they shut the doctors up and nurses that are working within the health authority with the Bill 36, which means you can't say anything. And if you do, you're fired, and you also lose your license, and you may have to pay a fine. So, do not question authority. Don't ask any questions. Just go to work and do your job. And the poor nurses tell me that it's like a revolving door. Nobody ever gets better. And they just keep injecting. They do thousands of electroconvulsive therapies every year. These patients are polydrugged, and they don't have a voice. They don't have a choice. Nobody listens. And they don't like me because I keep speaking out, and they are wrong with what they're doing. And When one of my cardiology friends asked them, why are you doing it? They said, well, because we're so overwhelmed. Well, maybe it's better not to do anything. And then one of the caseworkers from the foundry said to me, well, would you prefer them be suicidal? And my answer is yes, and to get the help they need, not to inject them with an antipsychotic and send them on their way so they commit suicide 10 days later.
So I have a question about how we resolve this, but before we get to that, you mentioned that a big part of the problem is that we have people who have no idea what they're doing, and this blew me away. But you said that the former Minister of Health of BC was a graphics designer.
So when I was looking at Dr. Kaur, who's also a University of Manitoba graduate, was talking about how detrimental the COVID pandemic lockdowns were to society, to our society as a whole. It set children back. People were learning online. My daughter actually finished nursing online during the pandemic and doesn't want to be a nurse. It was a terrible experience. The nursing program is very different from medical program. They do a lot more policy, protocols. You can't even compare. It's like apples and oranges. And then to have nurses injecting Plan G drugs, to me, is unbelievably dangerous. So first of all, that needs to stop. And yeah, where were we? I got off topic there. Oh, so the lockdowns. So when I looked at how did the lockdowns come about? Well, Jane Philpott had just resigned as our federal health minister. And the person that was put in charge of that portfolio was Patty Hajdu. And Patty Hajdu's background is in marketing and graphic design. It's not in medicine. And she imposed the Quarantine Act, and we were locked down. What happened at our hospital, and you couldn't even go in there to support a family member. You couldn't go in there with a book. Everybody was seen as carrying the COVID virus, and it was just locked down. And if you questioned anything, you were fired. The 30% of the nurses that were fired for not accepting the vaccine, they're still not back at work. They're relying on travel nurses and paying a lot more money for travel nurses that don't maybe have the experience that some of the experienced surgical nurses have. So there are pretty significant problems.
You mentioned way at the beginning that BC had the most, or was one of the most aggressive COVID lockdowns, or COVID measures. How has that sort of impacted our trajectory over the last couple of years?
Well, because of it, businesses were shut down. Students really suffered. I see a lot of people from University of Victoria. Many children are medicated. I'd say 1 in 4 kids are on mental health medications. Polypharmacy is common. Overprescribing is common. One of the experienced family doctors told me, Anna, just wait after this lockdown, what's going to happen. So you're seeing rising disability rates, rising unemployment. Kids don't want to work. Kids don't want to go to school. People within the systems are falling apart and claiming depression and PTSD and all sorts of things. And the work from home has not been, it's not really as satisfying as people thought it might be at first. And one of the a few family doctors that I was talking to have resigned because they felt that they resigned during this time because they felt their practice wasn't very enjoyable. Even though they made a lot more money doing virtual care, it wasn't fulfilling. It was episodic, and it wasn't what they had signed up for as family doctors.
Something else you said to me that also created like a light bulb moment: safe supply, like this concept of getting drugs that are safe, specifically for children. But
Mm-hmm.
and you said there is no safe way to do drugs. Why is it? What's this with this obsession of getting kids to do drugs?
It's fascinating to me. Even at the university, they're distributing booklets on how to smoke crack safely and how to recognize. Health Canada sent booklets to the doctor's offices how to recognize cannabis poisoning in children. And it all started. We legalized marijuana. Everybody was, and it's not the same. Marijuana can be pretty potent if it's not regulated. So the THC component can really damage a young brain development. And I used to cycle a lot to work to the General, and along the Goose where I cycled, kids were smoking pot in 2016, 2017, going completely stoned to school, before school. And then after school, the same thing was happening. So, the easy access to drugs and the colorful pills and just how accessible everything is, people will experiment and young people experiment. And of course, when they hear safe, they think, well, that must be a safe thing to try. So safe supply, if you look at where even the terminology came from, it seems to be coming out of Case Western University from a doctor named Dr. Ryan Marino. And it's also the same university that has Dr. Calabrese, who is the editor of the Journal of Psychopharmacology. It seems to me it's a very Purdue pharma or pharma-driven agenda. And, they give out 8 pills, eight milligram pills. That's 64 milligrams of OxyContin. That's the safe supply dose. Well, post-operatively, 2 milligrams is enough for pain control. So 2 milligrams versus 64 milligrams, these are like enormous doses of narcotics. But the people that are using it are already so accustomed to using narcotic and fentanyl that they often will trade in the safe supply to get from the dealer, they get their mixes of benzos and xylazine and whatever else they like mixed into their, whether it be ketamine, into their cocktail. And the safe supply finds its way in our high schools. And, there's been a doctor here, and an emergency doctor, who was pleading for them to stop the safe supply. And I understand we can't maybe stop it completely, but I think supervised injection is very different from safe supply, where you just give a bunch of pills to people and let them go into the community because you don't know what's going to happen, where those pills will find themselves. Or the ketamine that's being diverted. Janssen has really promoted the Janssen journey as suicide prevention and add-on treatment for major depressive disorder. And it comes in an inhaler, much like Otrivin, and it's ketamine. It's a very potent veterinary anesthetic, highly addictive, and it's a good date rape drug, and it's in our community. It's being diverted through the pharmacies.
It's crazy what's happening. I wanted to go to just a question from the audience for you. Andre is asking, do you rely on an interprovincial network of doctors with integrity? And do you have a list of physicians who have a conflict of interest?
I certainly do. I have, there are 5 physicians that I believe should be not just lose their license, but they should be in jail.
Bonnie Henry?
No, actually not Bonnie Henry. I think Bonnie Henry did her best to guide us through a pandemic. And I know a lot of doctors think like they can sue someone in government, but that's not how it works, because those people are protected. She has whether you like what, sometimes a person will say something. So I was very much for increasing the scope of practice of nurses and pharmacists. Jane Philpott was promoting naloxone. She felt that would save lives. But I think sometimes a statement and the way it plays out in real life is not. So a doctor can say something with well-intentioned, with good integrity, and yet the way it plays out, it's misinterpreted or it's taken. So naloxone, there's some people that are receiving naloxone 8 times a day. Well, what's the point of that? There's no point there. So, and I said, why are you doing this? And one of the nurses said to me, well, we're saving lives. Well, that makes no sense at all. We're offering MAID to the cancer patients, but we're saving lives with naloxone 8 times a day on the same person. Or the scope of practice. I never anticipated that nurses would be injecting Plan G drugs, which are depot antipsychotics. I never anticipated the close, cuddly relationship with pharmacists and drug companies, and the kickbacks that they're receiving in order, the business of methadone. There's been many articles on that. There's a business there. So we're making money off of human misery.
Sort of to wrap up the episode, the question I have is, what's the path forward? Do you think the solution is going to come from the medical profession? Is it going to come from legislature, or is it going to come from the judiciary?
So someone, no political party has the answers. And it's very theatrical what's happening. At the moment, I don't feel any one of them has the answers because we have a massive drug addiction and homelessness crisis. Yes, we have people that have incredible organic brain damage and they cannot survive on their own. A hotel room will not solve their problem. So the word institution terrifies people because just how badly, and I had spent time at Riverview, so how badly people are treated in institutions, in mental health institutions or institutions of any kind. Um, but that's one aspect. And then there's this other aspect where people are struggling financially, economically, struggling with their children, struggling with the education system. Parents don't feel they're being heard. And that group of people that are called, that need mental health support. And we're mixing it all together into one big, mental health and addiction. Well, they're completely separate topics. And I don't think we would have quite as much desperation and addiction if our economy was working a little bit better. And so we can keep throwing money at systems, but in my opinion, our healthcare system is beyond repair. So in my immediate community, the orthopedic surgeons had a group called Rebalance, and they were working to try and show how public-private partnerships could work. But it appears that it's really not working that well, and 2 of them are actually leaving the province. And so, the aversion to any sort of whenever I mention the Canada Health Act, it's supposed to be universal and accessible and available to everybody, but the truth is it's not. And we don't have universal health care, and it's not accessible, and people are on wait lists for 2 years, and cancer patients are being offered MAID very quickly. People are suffering, and in order to Jane Philpott has proposed that we have these pods where people sign up to a health clinic, much like when you move to a community, you can sign your child up to the local community school. So there's at least a place where you can report and they know a little bit about you, and there's a little bit of continuity of care, as opposed to the episodic care that's been happening over TELUS Health, where some of the doctors aren't even in British Columbia, they could be in the UK, and overprescribing of antibiotics, overprescribing of mental health medications with no access to a pharmanet, which means you don't even see that the person might be on these drugs from the cardiologist, these drugs from the respirologist, and now you're prescribing yet another drug, and nobody's paying any attention to the potentially lethal interactions. I can't hear you.
Sorry, I got dogs. I got to mute it every once in a while.
Yeah.
Final question: how concerned are you for your safety? Have you been threatened? Are you fearful of your life or your
So
life?
I've had great support. I decided the doctors will tell me, they'll come and they'll tell me and they'll feed me information. The pharmacists feed me information. The nurses all come and complain, oh, we have such moral injury, but nobody says anything. And so because I'm no longer part of Island Health and I have my own business and it's quite successful, I think I can step away and comment on behalf of everybody. But all my support that I have found are from the medical ethicists. So a person that I've found incredible sort of moral support in is Dr. Arthur Schaefer from University of Manitoba. And Dr. Carl Elliott wrote a book called The Occasional Human Sacrifice about whistleblowers in medicine. Dr. Nancy Oliveri was one of those people, and she called out Barry Sherman, who was Apotek, and it was an 8-year legal battle. But it looks to me like this is just, they want you to stop. They want to threaten you. They want to discredit you. So you just shut up so they can keep going with the status quo. But the status quo is not working. And anybody that says, oh, these drugs help or ECT helps, they're only looking at a very short window of, yes, it helps with discharge from the hospital, but does it actually help the patient long term? And the answer is no, and it causes a lot of damage long term. And to weaponize the law to take a child away from parents, for example, because medicine thinks they have all the answers. That happens quite a bit in situations where Jehovah's Witness needs a blood transfusion. Like sometimes the doctors will go to the ministry and apprehend the child. But to do that in situations of medical oncology where the parents may want palliation, to take all parental rights away. And this also comes into play with the gender reassignment and gender affirming care. Just to exclude parents is problematic. And with the Mental Health Act, anybody over the age of 18, they're on their own. Nobody can advocate on them. So advocate for them. It's a very unique piece of legislation that is unique to British Columbia. And the number of apprehensions under the Mental Health Act is actually quite alarming. Between 2008 and 2017, I think the apprehensions went up by 162%. And I'd be scared to look up the stats now, what's been happening and how many people, because they don't admit them to the hospital. What they do is if a person goes to seek support at the Foundry, a child, they could be apprehended by the nurse. And so then they're on extended leave in the community. And we have thousands of people on extended leave in the community, and they have absolutely nothing to offer them except these depot antipsychotic injections, which that's not a solution. And it makes them worse. Specifically, Abilify Maintain, I've been trying to get it recalled by the FDA and by Health Canada. And every time I have a meeting with Health Canada, they say to me, oh, thank you so much for your advocacy. We need more people like you. We'll call you back. And of course, I never get a call back.
So I guess in wrapping up, where can people go and learn more about you, follow you, or support you?
Well, I've been kind of lying low. I did my first interview that I did was with Simon, can't remember his last name, in New Zealand, and he was absolutely shocked and said that they don't use injections in New Zealand at all. And then I did an interview with Odessa Orlevich, and that was just before the election. And I was trying to explain to everybody how, we have the highest, so any political party wants to have more involuntary care. Well, we don't have the infrastructure, we don't have the manpower. We already have the most involuntary care in all of Canada. And all we're doing is force injecting people with antipsychotics. The taxpayers paying $500 a syringe for these antipsychotics. And who is benefiting? The drug company. And whoever high up decided that this was a good idea, with kickbacks, honorariums, and all sorts of incentives in order to keep doing it.
I hope I don't get this wrong. Dr. Sylwestrowicz.
Mm-hmm.
Doctor, how do we pronounce it again?
Sylwestrowicz.
Dr. Sylwestrowicz, thank you very much for coming on. And on behalf of the audience they're praising you in the comments, I'd like to thank you as well. And I wish you the best of luck.
So far I've managed to keep my medical license, but I did receive a reprimand from the college to say that I shouldn't speak out on social media. So I've been a bit quiet on social media because mental health is not in the scope of my practice. So I can speak about the heart and the lungs and the gastrointestinal system and the gut-brain connection and nutrition and pretty much anything that I've learned in my 33 years of both family practice and specialist anesthesia practice and neurosurgery and cardiac and everything, but I can't speak about mental health. And so that's why I've been lying low, because I'm trying to hang on to my medical license. And you can't report some of these people to the college because they don't care if a doctor reports. it would have to be a patient that reports. And so the college told me, because I had reported many of them, and the college told me they have completed their investigation, but they can't share the results of the investigation with me because I am not the patient.
Well, in light of all that, I think you're all the more braver for coming on.
Yeah, pleasure. Thank you. And what would I like to see happen? And it will happen. So Abilify Maintaina is coming off patent in December, which means all the money will have been made. So they'll stop doing it because there's no more incentive. There's no financial incentive from Otsuka. Invega is still on patent with Janssen, and Spravato is still being pushed by Janssen, so that's ketamine. So we'll see still a lot of that being used, because until we have sunshine legislation in Canada as to who gets paid what and why, and Dr. Joel Lexton has been asking for that for years, and pharma is too close to medical practice. Pharma owns medical education. Pharma owns many of the experts at the top of their fields that are writing the guidelines. And until all of that is exposed and until that is addressed, which Robert Kennedy promises to do in America, which I don't know how that's gonna, how he'll do that, but they're hoping to do that. Some of the experts that were working for Otsuka to promote some of the long-acting depot injections, I actually called each of them individually because I had the names from Robert Whitaker. They work with homeless people, so of course they're not getting consent. And they're getting massive amounts of money in the range of anywhere from 2 million to 6 million. And that's where the guidelines start. They start in respectable institutions like Case Western University in Ohio, and it kind of spreads, it funnels down. So if it's FDA approved, it generally becomes CADTH approved. CADTH is Health Canada. And who's in charge of Health Canada? Well, it's a home care nurse, and it kind of goes like that. And nobody takes any responsibility for any of the decisions.
So there you have it. If there's any provincial legislators watching, push for sunshine legislation and show us where the money's going.
And you know what else is a problem is that every time you say something, well, this is happening in BC, they say, well, if you tell that to the federal government says, well, that's a provincial issue. If you say it to the province, they say, well, that's a ministry says it's an island health issue. Then they say it's a ministry issue. Then the ministry shoves you over to, well, that's a federal issue, right? Because it's Health Canada approved. And so it's just, nobody answers the question. And so finally I was so discouraged. I asked one of my friends who's very high in politics, I said, Mark, does anyone ever tell the truth in politics? And he said to me, not usually. And I said, oh, okay. So he says, well, if they get caught, they do, but then they massage the truth. So there you go. And then people say to me, well, Anna, you're so loud and you're so, vocal about this. Why don't you get involved in politics? And my entire family said to me, you're way too honest for that. So that's what happened. I think transparency is the way to repair this. We need transparency, and we can't just shut people up just because they're questioning something. That's called critical thinking, and that is the scientific method. It's not a lawyer who's been hired by the federal government to stop the spread of misinformation. That's not the scientific method. The scientific method is research that's not pharma funded, open, honest debate, and not just learning from the psyched up medical education that's been entirely pharma funded.
Anna for Premier, don't listen to your family when they say you wouldn't be a good politician. You'd be great.
Yeah.
All right. Well, thank you very much for coming on, and a big thanks to the audience as well.
Oh, I want to say one thing. I was quite passionate about all of this in 2021, and I actually had a meeting with Laurel Collins, who was in tears over all of this, because I was presenting the case of a single mom whose hemoglobin was 67, and she had presented to the hospital. She had 3 children, And she landed in this program of depot antipsychotics. And another flight attendant who had an episode after too much, not enough sleep and a Tylenol #3, and she didn't feel good, and she ended up on this antipsychotic thing. And a helicopter pilot who was in this program and killed himself. So I keep pointing all these cases out to her. That was 3 years ago. She seemed very concerned, but has anything changed? Nothing. Absolutely nothing's changed. So they nod their heads, they pretend like they're listening, but nobody changes anything. And I think, in fact, it's probably, when I look at it, somebody in the Ministry of Health makes this decision, signs a pharmaceutical contract, or the health authority gets the contract, and that becomes a standard of care. And the head of psychiatry for the health authority is a doctor, but he's got his hands in pharma pockets. And before you know it, everybody is practicing like this, and the students are trained by Island Health, because we have an Island Health medical program, and they don't question anything because that's how they're taught. And this is how it plays out, where the patients are getting hurt, nobody's getting better, and you can write reports to QA, Patient Care Quality Office, to the Ombudsman, and patients can complain on Facebook, pathetic excuse for support, with 3,000 complaints, and nothing changes. So it's a little bit discouraging when you look on Twitter and you see that people have been advocating for decades, and it's only gotten worse.
Yeah, it's like I said, it's a bad feedback loop, or multiple feedback loops. Like, you have people in charge of the schools that are setting the policy, people in government that are benefiting from all these services, people in pharmaceuticals selling this stuff, profiting. And
Mm-hmm.
so when people say follow the money, like follow the incentive, it's all there.
Always follow the incentives. And
Uh,
there was a co-op student at the Ministry of Health in 2012 who committed suicide, and he was onto something. And the coroner deleted the suicide note. You can look it up. So the whole system is a problem.
yeah, I mean, deleting a suicide note, that just ties into abject corruption. And I keep going back to Kirk Reese. He's another the whistleblower. Um, but this stuff is happening everywhere. But it's very alarming. Yeah.
Yeah, it's alarming, and it seems like the criminal justice system is just as corrupt as the medical system. And I think, what I've learned is that if you don't have family support, whether you're a senior or a child or a teen, and you don't have someone in your corner advocating for you, you don't stand a chance in our healthcare system the way it's structured currently.
Yeah, it's really disturbing, and it's support. I equate that with money. Like, if somebody is working two jobs, they don't have the money to support their loved ones.
And
Um,
what I went through, so what I realized is that once they're under this Mental Health Act, this legislation, it's not so easy to get people out of there, out from under the act. And so these patients, Kirsten, for example, you meet with a mental health review board, and you're supposed to have legal representation. But the lawyers work for government. The mental health review board always sides with the psychiatrist attending the patient. And so these people honestly are scared, they're coerced. Many of them don't want to go on record, they don't want to be interviewed. I've spoken with them, I've got all their stories written down, but they're really quite scared. And that's, as my daughter says, who finished nursing, she says, it seems like everything they do is completely counter to any sort of healing.
it's almost like
And
they're doing the opposite of what they're paid to do.
it's complete opposite. And to think that, because I also, one of the pharmacists was a good friend of mine, and he said, he never thought about because these are all pharma funded for-profit clinical trials that are being run in the hospital. And he never even thought about the fact that these people are not signing consent. Or if they are signing consent, they've been forced and coerced into signing it. So one of the women that signed the consent, they told her that her children would be taken away if she didn't sign.
That's horrific. Like I've encountered that on very minor, on a minor scale, where they say, answer our question, or you'll have to wait 7 hours for your lawyer. But that's a threat. You're
It's a
basically
threat. It's a
saying,
threat.
like, do sign it, or we're going to kill your kids.
That's right. And an
If I
anonymous
did that, I'd go to jail.
one of the hospital pharmacists texted me and she said, the longer I work here, the more I realize that we're harming more people than we're helping. The hospital pharmacist wrote that to me. So medication error is very common as well. And if you think about it, these are incredibly potent drugs. So if there's no continuity of care, there's just, if the pre-printed orders are for Q1 hourly antipsychotics and benzos at the discretion of the staff, and charting is very disorganized. Some of it is on paper, some of it is in power chart. Mistakes are very common. And because they don't have the beds, so some people will be kept in the hospital, but many are just detained in the community, and they're under these community orders where they are observed by caseworkers. So, and these caseworkers think they're helping them when in fact they're harming them. And with Kirsten, we wanted to prove them wrong. So we ended up doing all her blood work, and we sent her for pharmacogenetic testing. And they honestly don't have a leg to stand on. They haven't done an EKG. They haven't done any of her blood work. She is inflamed. Her C-reactive protein is through the roof, and nobody cares. And the psychiatrist, we have him recorded as saying, my job under the law is to make sure that you get injected. No,
It's funny.
your job under the law is to try and give you mental health support or help you or talk to you about why you're feeling this way, not to get you injected.
This is that right now I got a comment from the audience. The lawyer they sent for me said the doctors aren't there to help me. It's recorded.
That's correct. So the lawyers and the ethical psychiatrists, because there are good psychiatrists, they're just working in a system that's incredibly corrupt. Their recommendation for people that are caught in this, and I've talked to many people, that you have to leave the province. You have to get out of here. So so those people then are lost to follow up. The forensic psychiatrist says those people are listed as lost to follow up. Or I don't think the coroner ever really looks at the ties with Abilify and suicide. Because if an injection was given a month prior, they don't see that as the reason for the death. They see the toxic drug crisis as the reason for the death. So Abilify causes compulsive behavior. There's FDA warnings, Health Canada warnings that you have a compulsive urge to gamble, eat, drink, use drugs, smoke, vape. It causes severe akathisia, severe insomnia. So people then start self-medicating. And then if they overdose, it's written off as the toxic drug crisis. Or I suppose if their COVID test was positive, they would say, oh, it's a COVID death. And I can tell you for a fact that there were an awful lot of overdoses. Not as many COVID deaths in the ICU, but there were a lot of overdoses during the pandemic lockdowns.
Well, if one takeaway from what you said, that 30,000 person figure, the detentions, I was not aware of that. And I'm ashamed to say it, but I thought this would never happen in BC.
No, it's I correspond with an international community of doctors, and just what happened here was this perfect storm of very aggressive lockdown, no beds, no family practice offices, all the walk-in clinics had closed. People didn't know where to turn for some help. A lot of people lost their jobs. There was a lot of domestic abuse. There was a lot of sexual abuse. Lots of things happened. They turned to the system, to the emergency for help. And all that happened was a drug trial. Pharma funded, for profit, without consent. But this has been carrying on now for a number of years, because it all dates back to about 2012 when that Rod McIsaac committed suicide. And it was all about the sharing of data with drug companies without patient consent. And so in psychiatry, because it's a mental health issue, they can really abuse their power. They can say that. And also with dementia, also with early cognitive decline, it's actually quite scary what's happened to a woman named Eileen Wicks. She was locked into the hospital during the lockdowns for 8 months, and her husband couldn't get her out.
Wow. Anna, unfortunately, I have to end the episode, but if I could just hold you over, I need to talk to you about something.
Yeah,
And again, thank you very much for coming on.
you're welcome.